Hi, I'm Dr. Schels with Advanced Chiropractic, and one of the questions that we get asked quite a bit by patients is, what exactly does the vibration therapy do? You know, a lot of patients that we see, we adjust them, then they come over and they do this vibration therapy, and of course, we always want to make sure that the patient understands exactly what the purpose of the therapy is. So I'm just going to run through and explain exactly what it does. So when patients come over after their adjustments, a lot of them will do this therapy. And what it is, this is Kendall, our office manager. I'm going to have you step down for just a second here, Kendall. So let's say that we looked at your x-rays, and Kendall doesn't have this, but let's say that in Kendall's case, her spine shifted, and because of the shift, her shoulder was dropped down like this. So when we looked at it, the left shoulder was lower than the right because of this alignment issue in the spine. So does it make sense that if we were to put weight here, and of course we have the patients put weights on different areas based on their x-rays, if we were to put a weight here to compensate for that, her body would have to tighten certain muscles to actually hold that up. So if the shoulder is low on this side and we put a weight there, the muscles that go from the neck out into the shoulder will tighten up a little bit. And now, whenever she gets up on the vibration here, you step up, and now the vibration plate is vibrating at 30 times a second, and it's getting some muscles, especially the ones that are already a little bit contracted, to contract and relax a tiny bit 30 times a second. And when muscles contract and relax, over time they get stronger, but they also get shorter. So what the therapy does over time, it would get the muscles on this side to contract and get shorter, and over time help with the chiropractic adjustments and with the exercises to actually level her shoulders off, which would be considered normal, right? So you can use it for that. We also use it for a lot of people who have a reduced curve in the neck. So in the neck, if you put the weight on the front, and what happens is the muscles in the back of the neck will contract and relax and get tighter and smaller over time and shorter. And so what that does is it helps to bring the head back and put more of a curvature in the neck. So we like to do this vibration therapy for patients. In the beginning, a lot of times when patients are on it, their nose will itch and it'll feel a little bit strange. Their eyeballs kind of move around a little bit, and that's completely normal. For most patients, as they do it over and over, it gets easier. Some patients get to the point where they really enjoy it, and the thing that we enjoy is it helps so that when we redo the x-rays, we see changes on the x-rays. Of course, it's a part of the overall program for most people, but I hope you found this to be informative, and if you ever have any questions in the office, we do encourage you to stop, ask the doctor or ask the staff, and we'll do our best to answer your question. Again, this is Dr. Schels with Kendall at Advanced Chiropractic. Have a great day.